Mr. Smith, due to your complaints of chest pain and the results of your recent stress test, I'm ordering a heart catheterization to be done tomorrow. Do you know what a heart catheterization procedure consists of? Oh, you don't? Okay. Well, the procedure is fairly common. Catheterization procedures are done in a special operating room. The room has special x-rays and imaging machines that normal operating rooms don't have. During your procedure, you'll be awake but sedated. An IV will be put in your arm or hand, and the medicine will be fed through that you might need during the procedure. Also, monitors will be placed on your chest to check your heartbeat throughout the test. Before the procedure, the nurse will come in and shave your hair from the site where the catheter will be inserted. Before the catheter is inserted in your artery, you'll be given a shot to numb the area, which you may feel a quick stinging pain before the numbness sets in. Once the numbness takes place, that's when the catheter will be inserted. To do so, a small cut in your leg will be made in order to access your artery. Then, a plastic sheath will be placed in the cut to allow for catheter to be inserted. I will then place a long wire through the sheath until it reaches the heart. Do you have any questions yet? Okay, because we are checking for blockage, once the catheter is in place, a dye will be injected through the catheter and x-ray images of your heart will be taken. You will experience a brief warming sensation. This dye will allow me to see how well the heart is pumping, narrowing or blockage in your arteries or heart valves. Although you'll be sedated, you'll be awake during the procedure so that you can follow some of my instructions. Throughout the procedure, I may ask you to take some deep breaths, hold your breath, or cough. I'll need you to do those when I ask you to. Now, after the procedure, it'll take a couple hours to recover. You will be taken on a gurney to a recovery room until the anesthesia wears off. While in the recovery room, the sheath will be removed. Once you leave, you will head to an outpatient room where a nurse will apply pressure to the insertion site. It is very important that you lay flat on your back for 1 to 6 hours after the procedure to avoid serious bleeding. Depending on the procedure and how you are after, you may be able to go home tomorrow night, or you may have to wait until the next day. Do you have any questions or concerns, Mr. Smith? Now, hopefully no blockage is found, but if the results come back that a blockage is found, there are multiple options of what we will do. Depending on the severity, you may need angioplasty or a stent, or if it is severe, we may need to do an open heart surgery right away. Now, if we go to the angioplasty route, we may perform it with or without a stent placement right away so that you won't need to have another cardiac catheterization. We will discuss this in full detail, though, once the results come back tomorrow. Any last questions? Okay, well, Mr. Smith, get a good night's sleep tonight. Do not worry about the procedure. It's very common, like I said earlier, and you are in good hands. Have a good day, and thanks for coming in, and I will see you tomorrow. Thank you.